A good one today. Good morning, everybody. Welcome to the Nurse Mark and the Green Nurse Daily Dose of AFA.
Where we bring you hope and inspiration, growth and healing, so you can start your day off the AFA way. And in case you have forgotten what that means, Mark wrote a book all about it.
I did
really good
so
stuff.
that you don't forget.
You don't forget.
Listen, we got to be reminded every single day because we go into default mode, into habit mode, and we get caught up in the living of life, right? But not the real living. We're just automated robots going through the motions. Yeah. Oh, yeah. But remember, at your core, you are absolutely amazing. There's nothing to change, nothing to make better. No more knowledge needs to be had. You are it.
And so how do we do it differently? Right? Here you go.
Right.
We've talked about this before, Mark. You know, we're in these robots, we're conditioned, we do the same thing over and over because it's safe. It's safe.
It's safe. It's safe. Think about it. I'm telling you, look at your routine tomorrow. When you get up, look at what you do. You get up, you go pee, you go make the coffee, you come back, you do this, you do that. But you have a routine. You brush your teeth with the same hand in the same exact way every day. That's the tell right there. Think about it. When you brush your teeth tomorrow morning, think about the fact that you do it exactly the same way every single time. Try switching it up and using your other hand. The one is not your dominant hand. It's a weird experience.
Woo! Right. Oh my God.
Programming.
Absolutely. All programming. So here's the fun thing. When you switch it up and do it differently, it does stimulate creativity and imagination.
It does.
So just a quick thing. So I was up late last night reading and meditating and, working and all this stuff. So finally got to sleep, woke up this morning and I didn't get everything done I needed to get done, blah, blah, blah. So then I was like, am I going to go into automatic, frenetic, crazy, got to get this done right away? No. I pulled out my cannabinoids, took those first and foremost. And then I decided to shift what I did.
Yep.
This is what I was like, how can I do this differently? I've given birth 3 different ways differently. So I hopped in the tub, cleaned the tub, hopped into the tub, and I started to do the 44 breath meditation.
Oh my God, in the tub. I love it. You can do it anywhere.
You can do it anywhere. And let me just tell you, I just brought it all back in. I'm floating in this space. I'm doing the 44 breaths. I'm starting to have this psychedelic experience. And I'm like, wow, what a cool new way to wake up. Right? Self-soothing. And these are the different things that we're teaching. Cannabinoids are adaptogens, and they help to open up our minds to self-soothe, take care of ourselves. And so I was able to, with cannabis, with breath work, with affirmations, with meditation, with your book right at my tub.
Boom. You self-soothe is self-love. And that is the root of an amazing, powerful, happy life. Because sometimes we go through life and we think, well, without this other person, I'm never going to be able to make it. Like they've always supported me and been there for me. And, I really need them in order to succeed. And then, and then they're gone. Right. And they move on from this life and you're left wondering how the hell you're going to go on. And the fact of the matter is you'll go on just fine. You're always the one who is most powerful in your life. So what you think is what you get. And so we're going to talk about that. Morning, Ashley, Jack, Beth, welcome. Good to see you all this morning. Happy Wednesday. All right. So this rolls right into the daily love.
Love it.
So this was perfect, Sherry. And this one is from Around the Year with Emmett Fox, my man, Emmett Fox. And so this is called Dissipating Evil. And shirt, by the way, I am inspired. You inspire me. All right, so here it is. This is good. I'm going to read the whole thing, and bam, we're going to just do this. So, if somebody comes into the room at home or into the shop or office looking as if he or she is to make trouble, just try switching your attention straight to the divine instead of squaring up aggressively to meet the difficulty or shrinking away to avoid it, according to your temperament. You'll be amused and gratified to see the anger fade from the subject's face, which will mean that it has faded from his heart too, and quite a
Mm.
different expression takes its place. And he goes on to say, I've seen myself several cases where men, and on 2 occasions children, were actually fighting. And upon a spectator's turning the cheek, the strife ceased like magic.
Oh,
Animals respond even more easily to this treatment than do human beings. I have seen 2 instances where dogs were fighting savagely, and all efforts to separate them had failed when the realization of presence of God's love in all creatures restored peace. In one case, it took several minutes to work. In the other, it was practically instantaneous. So what old Emmett is talking about here is you have the power by the emanation of the energy that you bring into the room to change what's actually going on in the situation. So in a confrontational experience, if your energy is turned toward the divine, the universe, God, love, whatever you want to call it, because I'm all about whatever your idea of of God is, of the great, spirit source, whatever you call it, is
the
just
great I am
absolutely perfect.
presence. The
That's
great,
totally up to you. It's because this
yeah,
is your life, this is
it's
your
your life.
story, this is your reality and your experience, and you get to choose,
You get to
right? You
choose.
get to choose.
Yeah.
So in this case, he's saying if you choose to turn your awareness to that, you're channeling that energy into the room, into the
Yes.
situation. And so here's my challenge for you all today is wait. And when you see a situation pop up like this, like somebody walks in the room, you can see they're pissed, or somebody's waiting on you, you can see they're not happy. Just turn your attention to the source, turn your attention to the divine for a moment, and
Yeah.
just focus your awareness on that and see what happens literally to that other person.
Okay,
Ah,
and we can make a story, we can make a comparison too when we see
sure.
patients for the first time. So think about this.
Hmm.
Oftentimes as cannabis nurses, patients come to us as a last resort. A lot of times
A
patients come
lot of
to us
times.
angry because the traditional system has failed them. So
Yeah.
what can we do? So when we have a patient that's fearful and scared and angry
Mhm.
about what happened to them, what do? We focus on their heart space. We
Yes.
do that, have that transpersonal connection.
Hmm.
Stop and pause and
Right.
realize and understand that they're having a human experience of fear and anger about what happened to them
Mhm.
in the past, and we don't have to take it on. We don't have to buy into the story, but what we do as nurses is we sit with it. We become the healing environment for them to be able to unload, and we
Yeah.
contain that space through the love, right? Through love,
Mhm.
kindness, compassion. Because what are we really trying to do here for these patients? We are trying to bring them hope, inspiration for
Inspiration
growth and
and yeah,
healing.
we're trying to get
Right?
them high.
Yes.
Isn't
Yes.
that amazing?
Yeah.
That's it.
Love it. Great job.
Jerry, Jerry, the truth of the matter is that we are all powerful. We
Yeah.
can literally move mountains. We can make it all happen. The only reason it doesn't is that we just don't really believe that we can.
Right.
So without that belief,
Yeah.
not gonna happen.
So here's the other thing too. If you don't believe, that's
Mhm.
okay. Believe that we believe that it can
Yeah,
happen, right? So if
yeah,
it can happen to me, I'm telling you
yeah,
right now, it can happen to you. It's just that change of perspective, that miracle, that aha
yeah.
moment. And you know what? You know what it's going to take? It's going to take you guys showing up here every morning so we can tell you
Oh
how
my
AFA
god.
you
Sherry,
are.
think back to when you were at your worst before cannabis entered your space. Can you imagine from where you were then to where you are now?
No, I now
Right?
looking back, I look
Yeah,
back and I'm like, wow, what a
right.
miracle. And it
Miracle.
basically all it took was for me to lift the shades up,
Yeah,
right? And to
yeah,
start to perceive things from a different way. And cannabis was a
right.
great, great tool because nothing else worked. And
And
then once cannabis,
yeah, nothing else worked, and you tried
nothing,
everything. And
everything.
at the end of the day, it took one other human
Human
being
being to
to
connect.
you, someone that you trusted, saying to you, hey, try this.
Try this.
You were
Basically,
you had
it
no
was,
hope. You had tried everything. Someone came to you and said, here, try this. And that's why
and
we're here. And that's why you're here, everybody, because
yes,
we're the ones that are going to say, here, try this.
try this. And you know what? Because we've been there too. So
Yeah.
the woman that turned me on, she was 70 years old. She was a retired nurse and she had been using cannabis for 53 years. And she connected and disclosed to me in the most intimate way her
Yeah.
relationship with the plant. And through that, I was like,
Hmm.
what? Oh my God. I got to, And so,
Yeah.
anyways, the bottom line, the rest is history. It
The rest
really
is
took
history.
that.
There you are. And listen, you're thriving. Like you're not just living a mediocre life. Holy shit, you are thriving. Like you are operating way beyond the capacity that you ever had before.
Truly, I am. And this is how I
Yes.
look at it.
Yeah.
Cannabis rewired my operating system.
Boom. Just like that
Boom.
opened you
That's it.
up. Man, I love seeing the posts we get up on here. Maria, you sent an angry face. What's going? Oh, yeah, that's funny. Yeah, I know. Melissa, Stephanie, Brian, spot on, man. You're right. Cannabis saved your life and it saves a lot of lives. Melissa, you guys are awesome. I
Yes.
really, I mean, it's community. We're all here.
Yeah.
Imagine if it was just Sherry and I talking to ourselves, which by the way, we totally do. Like we could totally, Sherry and I could have a conversation every morning for a half an hour, but you make it what it is.
Yes. And
Yes.
here's the cool
Yes.
thing. There
Your
was a
love,
really
your participation
yeah,
absolutely makes this what it
makes
is.
it. Well,
Yeah.
this is it too. So I found this really cute picture and then we'll get started of
Yep.
this little boy who was playing a pipe all by himself.
Mhm.
And then there was a little kitten sitting there looking up at him. And basically, the quote around that was,
Love
you
little
know,
kids.
do it for yourself first,
Hmm.
the rest will follow. Right?
Yeah.
What? Oh, there you go.
Yeah.
Mark, I'm going
You
away
got the
again.
green dot, Sherry. I can tell. You got
You can
frozen. Now
tell
you're going to come back in a couple of sudden. There you are. And now the green dot's up.
there's
Spirit is there with you, Sherry.
well, can I tell you, it was something that I needed to hear. So the computer started flashing. Everything has gone away. I have a
Yep.
green dot right in the middle of my computer, and I know you're all out there somewhere.
Hmm.
And I have my notes, so we can continue on to the next segment. So this is
And we
great.
will. And so today, Wednesday, we've got a great topic today, which I have definitely had some experience with, not personally myself physically, but family members who have had to deal with these issues. So here we are.
Yep.
Wellness Wednesday is wisdom for wellness. Sherry, what's our topic
Yes.
today?
So our topic today. So what we've been doing, Mark and I, throughout the past year.
Mhm.
God, we've been doing this for a while now, which is awesome. But we've been looking at health awareness topics
Uh-huh.
and bringing them to you guys to discuss what they are, and then to talk about cannabinoid therapeutics, the
Mhm.
research, what it shows, and how people are using this plant in conjunction with these different health awareness topics.
Mhm.
So May is
Mhm.
American Stroke Awareness Month.
Right.
The hashtag is Relentless Together. And
Yeah.
so it was created in 1989 by the American Heart Association, and it was created to promote public awareness and
Mhm.
reduce the incidence of stroke.
Yeah. Yeah.
So, Mark, what is a stroke? A lot of
Oh,
people, I
baby,
mean,
here we go.
yeah,
Also known as a CVA, a TIA, cerebral infarction, cerebrovascular accident. It's a loss of brain function due to lack of oxygenation to the
oxygen.
brain. Your brain takes most of the oxygen in your body. Like the large amount of that conversion, the energy that happens feeds this big thing up here, right?
Yeah,
Or
this big
this big
squash.
thing down here, because your brain is not just in here, it's
Right.
distributed throughout your
Connected.
body, which
Yeah.
is the most cool thing ever.
Yeah.
Um, so it's a disease of the nervous system, or it's a disease of the circulatory system. So,
Because they're all
Sherry,
interrelated.
yeah, it's all
Right.
interrelated. So there are different kinds of strokes, right?
Yep. So, the interesting thing is that there's the ischemic stroke. So just think about
Hmm.
when people have a myocardial infarction or a heart attack, right? So they
Yep.
have an obstruction in that vessel, And
Mhm.
what it does, it prevents blood from reaching the brain cells on the other side of the obstruction.
Mhm.
So it blocks oxygen from reaching those brain
Right.
cells. So if you have a blockage on this side and you're not getting blood to this side, it's going to affect the other side of your brain. And so
Yeah.
it can cause tissue damage or death, depending upon the
Right.
type of area of the brain that's being affected, by the vessel that's
Mhm.
being affected, the vessel that's been clogged. So it's
Right.
ischemic stroke, think heart attack, very similar. That's the first one. The
Mhm.
second one is called the hemorrhagic stroke. So, what it results in is a ruptured blood vessel,
Right.
right, that causes blood to leak, which produces the same consequences of oxygen
Mhm.
rich blood not getting to the area of the brain, causing that tissue damage or death.
Right. Right.
Right?
Yeah.
So the third one isn't, this one is considered to be, it's the TIA that they talk about, which is a transient ischemic attack. Transient
Yep.
doesn't mean all the time. It's a temporary blockage in the artery, and it may not cause permanent damage, but
Right.
it can increase you for the risk of stroke.
Sure. Absolutely.
Yeah.
So here's some of
Symptoms.
the symptoms. We're is healthcare professionals. We're trained to assess for stroke, like in the field immediately. And
Yeah.
there are things that you do to assess. So you'll have an altered level of consciousness. You'll ask the person questions like, "Do you know what day it is? What's your
Right.
name?
Right.
And where do you live?" Things like that. You can have aphasia, which is the loss of ability to understand or express speech, right?
Right.
Receptive aphasia versus expressive aphasia. So if
Yeah.
you've lost the ability to respond to somebody asking you questions, it's an indication.
Right.
One-sided weakness. So we'll ask people to raise their arms up. And if one side droops, then we know one extremity is weak or flaccid, or if one side of the face is droopy, we know that there's an
Something
event
going
happening,
on.
a
Yeah.
stroke event. Unequal pupil size, right? So it'll change the size of the pupil because the amount of oxygenation which is getting to that particular side of the brain.
Yeah.
Ataxia, loss of full control of body movement, and then you'll have nausea and vomiting.
Right.
So here
Right.
they are. So here's the fast warning signs. Go ahead, share.
So the fast warning signs is great. So think about
Yep.
fast. Face, arms, speech, time. So
Hmm.
F is for face. If there's a
Hmm.
facial droop or an uneven smile on a person's face,
Yep.
indicate, just let a little right light bulb go off.
Hmm.
Arms. Is there arm numbness or weakness? So we ask the patients, Mark just said, to raise their arms up. And
Yep.
it's a warning sign if one of the arms drops down or is not steady.
Hmm.
Speech. Ask the person to repeat something. The
Right.
slurred speech may be a warning sign. And then time. If a person is experiencing symptoms, time is to act fast.
Time
Right?
is critical because in the event in the example of a TIA, there are medications that if they receive them within the first hour or two, I can't remember it's a very short window of time. If the person receives that particular medication, there is a much higher likelihood that the damage is decreased and they'll be able to recover from this stroke much more quickly. So time is hugely important. And a lot of folks just kind of shake it off. They're like, I'm okay. I kind of feel a little funny, but and nobody really wants to go to the hospital, right? It's a
No.
drag.
Mm-mm.
But time is of the essence. So,
Yeah.
really getting somebody to the hospital as quickly as possible. Now, we're going to talk, of course, about how cannabis has a positive influence.
Oh,
And it truly does in this case.
truly does.
So,
Yeah.
additional symptoms. What do we got? And unique symptoms that women may have, because many times women have different symptoms than men, especially
Right.
in cardiac issues
Yeah.
and now in stroke. So, Sherry, what do we
Yeah.
got?
So, some other unique symptoms that other patients may have and women may have include vision troubles in one or both
Mhm.
eyes, numbness in the limbs, most likely on one side,
Mhm.
overall fatigue and generalized weakness, trouble
Mhm.
walking. Some patients have fainted, shortness of breath,
Mhm.
sudden behavioral changes. You think about this. If you're not getting
Yeah.
oxygen to your brain,
Mhm.
what's going to happen? It doesn't understand what's going on. So you may get irritation, hallucinations.
Yes.
Sometimes patients get seizures. Really interesting.
Yes.
So, having a stroke also increases your risk for having another one. So when we talk
Yeah.
about stroke prevention, the best treatment
Yep.
for a stroke is to prevent it from happening in the first
Now this
place.
is perfect because this is going to apply to my Grammy Worcester, my father's mom. We'll we'll talk about her in this particular segment because she had multiple strokes by the time I came around,
Mm.
and according to everyone, who was a different person. She was delightful. She was hilarious. She had no filter, and maybe as a result of the strokes. But let's go down the list, Sherry, and we'll add Grammy in here as we go.
Yeah. So,
Yeah.
and think about the endocannabinoid system. These are things that we
Mhm.
talk about. So, minimizing risk factors
Yep.
actually has to do with taking care of our endocannabinoid system.
Hmm.
So, your diet, eating more vegetables,
Right.
beans and nuts, they say, good, healthy protein, eating
Hmm.
more seafood or instead of red meat and poultry, even considering a plant based diet,
Yeah.
limiting the intake of sodium, fats, sugars, and refined grains,
Hmm.
increasing exercise. Motion is the lotion,
Right.
keeping your body flowing, the oxygen
Hmm.
moving,
Yep.
quitting tobacco, quitting
Yep.
alcohol. And
Yep.
then if you do have high blood pressure,
Yeah.
and you do need to take medications, take
Yeah.
them,
All right.
until you're right.
Yeah. All right. Let me tell
Yeah.
you about Graham. Graham never ate
Graham.
vegetables, beans, and nuts. No, it was all, canned food, stuff like that. Uh, Seafood, maybe occasionally, but really red meat and poultry, right? No idea about sodiums, fats, sugars, and refined grains. And guess what? She was a diabetic. Her father was a bad diabetic. So
Mm,
she cheated. She didn't eat right. She didn't manage her diabetes well. And exercise, I don't know. That generation, exercise was just not a thing. What exercise was, you got up and you went to work and you
right.
made money and you tried to live life, right? There was no
Right.
concept of exercise.
Right.
And as long as I knew her, she smoked. And it was she was this kind of smoker. She'd be up late at night watching TV in a dark room and get up and I'd see her sitting in her chair and she'd take a drag off of that Virginia Slim 100, those big long cigarettes. She would take such a long haul. You'd see that light up the tip of that cigarette and then no smoke would come out on the exhalation. So she was a serious smoker.
She was holding
Yeah.
it.
Right. Didn't drink alcohol
Oh,
though, didn't have high blood pressure, I mean, as far as we know. But
right.
all of this, all of the strokes that she had were all, primarily related to lifestyle.
Right.
So I know it
And so
pretty well.
right? And so if you hear coronary artery disease, that's like, let
Yeah.
that be an indicator that you need to
Mhm.
really pay attention to your cardiovascular health, your blood
Mhm.
pressure, your heart
Yep.
rate, your activities of daily living and lifestyle, right? Because
Mhm.
cardiovascular disease, you have those net narrowing of those vessels, plaque
Yeah.
build up, clots can
Mhm.
form. We want to prevent that. So,
Mhm.
what is the good news? Okay, this to me is amazing because we're going to talk about studies. There's only
Yes.
54 total studies, but they're very, very promising.
Very promising.
When you look at these results, they're
Mhm.
mind boggling. So,
Yeah.
Canakes looked at everything. There
Yep.
was a total of 54 studies, 2 lab, 26 animal, 9 meta analysis where they're looking at a ton of different data and bringing it together.
Mhm.
1 double blind human trial, but 0 clinical human trials. So I don't know how that works, but 1 double blind human trial. So the part that is so interesting is over all of this research, the literature, and
Mhm.
the what they were able to analyze was that the
Yeah.
overall positivity of these studies was 89%.
Yeah.
Clinically, so think about
Uh-huh.
clinically is when we're looking at details of what's going on in
Yeah.
our body. So
Yeah.
clinically, you ready for this? Big one.
Mhm.
100% positive. 100% positive clinical
Yeah.
results using cannabis as medicine for stroke.
Right.
I was
Right.
like,
And Sherry, just that is amazing. And so, just to step back real quick to that 0 clinical human trials. Well,
yeah,
when you're setting a trial up, you're looking at risk benefit. And,
right.
think about it. At this point, we're talking about people who are having a stroke
Stroke.
who may die. Like
Yeah,
it's serious. So the
it's serious.
risk of trying to do a study of cannabinoids and whether they are
Yeah,
going to have a positive effect, they're probably going to stick with what they've been doing all
no.
along.
Yeah.
So it's going to be more of these lower level studies. And I think a lot of anecdotal evidence as time goes on,
Done.
we'll get it introduced, but, let's continue to talk about this because cannabinoids have such an amazing
Huge.
positive effect
Yeah.
on neuroprotection, neurogenesis. Let's keep going.
Yeah. So we're going to talk about the synopsis. So the different research for
Hmm.
stroke and what they came up with. So they basically stated that modulating the endocannabinoid system, the most important system in our body, with
Hmm.
cannabinoids and other health and wellness tools that nourish it, produce mostly the cannabinoids,
Right.
produce the therapeutic neuroprotective effects to
Hmm.
counter stroke pathology. So think
Right.
about that, right?
Right.
Countering. And so what does that mean? So it helps with inflammation. We know cannabinoids, right, help to decrease inflammation. So when people are having a stroke, they have all of those pro-inflammatory cytokines going to the area. Inflammation
Hmm.
wreaks havoc.
Right.
The other thing I like too is what it does is it helps with the lack of metabolic maintenance. So you think about
Hmm.
we have metabolic processes going on
Hmm.
throughout our own body at all times. The on
Right.
off switch, the endocannabinoid system, keeping our body in balance or homeostasis. So when we
Right.
have a stroke, we may have a lack of those balances, right? Because things are
Exactly.
disrupted. Really
Yeah.
powerful.
And it helps
But it,
with vascular tone, right? It's
Mhm.
gonna dilate the blood vessels. It's gonna open them up. And that's what in some cases, that's what we want, right? We
Right? We
want
want
those vessels to open up and
open.
flow a little bit smoother.
Yep.
And it helps with endocannabinoid tone. It
Tone.
helps
Yes.
our own natural endocannabinoids
Right system. Yep.
more
Another
efficiently.
great thing, and back to the anti-inflammatory
Yeah.
thing, right? What it does too, it helps to decrease
Mhm.
edema or
Right.
swelling, fluid in the brain. And
Yeah.
a lot of fluid in the brain can cause more ischemia or
Yeah.
tissue death, right?
My mom had a major stroke, and it ended up being related to pancreatic cancer, which we didn't know that she had, but she had a major stroke, and it was a hemorrhagic stroke, and they literally had to take a piece of her skull bone out, and they do this quite frequently when you have a hemorrhagic stroke or you have traumatic brain injury. They'll remove a part of your skull to allow the brain room to
Just well,
swell. Because
yeah.
it's the swelling within the brain that will actually kill you because it just doesn't have room to expand and it just causes so much trauma to the brain. So they
So
do
you
that
think,
frequently.
and they monitor intracranial pressure. So at the
Yeah.
same time, right, they'll put a
Mhm.
little hole in the head, they'll put a little
Mhm.
bolt in, and the
Yep.
bolt's connected to a monitor, and you want to know and see what their pressure is because the higher the brain pressure, the
Mhm.
more chance for damage of the
Right.
brain,
Right.
right? And you think about it,
And
we're
cannabis
contained,
is
our
gonna have
brain,
that positive effect, right?
yeah,
Yeah.
right. So think about this, the brain is completely contained by our skull. If it
Mhm.
swells and swells and swells, where does it go? Guess what? It goes where we don't want it to go. Brainstem starts to collapse, and then
Mhm.
you have instantaneous death. Not
Exactly.
good, right? So
No.
we
No.
not
No.
good. So the other thing that I liked too about, the research, it actually showed that it helps with the neurotransmitter glutamate to
Yep.
decrease that excitation. And
Mhm.
it also helps to decrease oxidative stress. When we say something's an antioxidant, we look
Mhm.
at it as, antioxidants help protect our cells, right? Also
Yep.
help the ability of nutrients to go in and things to go out. So decreasing that oxidative stress also
Mhm.
decreases inflammation,
And
right?
that is probably the biggest benefit is that decrease of inflammation throughout that whole process.
Yeah.
Yeah. Yep. And it may so we know it may be beneficial as that neuroprotective agent, right? So
Yeah.
with those who are prone to strokes, it may be work really well with first line drug treatment in patients with acute
Acute
stroke.
stroke. Yeah.
Yeah.
Yeah, so that's what's great too. So studies primarily have been
Mhm.
done with the chemo type 3, which
Yeah.
is CBD dominant, right? So
Mhm.
CBD dominant, whole plant medicine.
Yeah.
And the thing is too is that cannabinoids are beneficial pre-stroke, during stroke, post-stroke, right? So we want to look at these you have coronary artery disease, high blood pressure,
Mhm.
all of these risk factors.
Right.
Consider cannabinoids as a tool, a health and wellness tool to nourish your endocannabinoid system. So if something like that does happen, you are going to decrease the effects,
Right.
the debilitating effects that can happen.
Decrease the damage. Right.
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 So how do we work with stroke patients, Mark?
Hmm.
You know,
Yeah.
we
Listen. Yeah.
TLC.
Yeah.
we, we we look at everything. So when patients come to us with
Hmm.
complex medical histories, we don't just look at one thing. We look at multiple different things. So that's why the intake paperwork is important. We look at their past medical history,
Hmm.
their current problems, their current meds and therapies, asking what is the goal of therapy? Are they plagued with stigma? And then we meet patients where they are. We look at lifestyle factors and we take them
Yeah.
down that journey to start choosing cannabinoids based on
Yeah.
research and science and where
Uh-huh.
they're at to start to auto regulate their bodies and start to heal.
Yes.
Yeah.
Yes.
Yeah. So 100%, that's the thing. I'm going to remind you,
That's the takeaway.
100% clinical positive results, cannabinoids with stroke patients.
Cannabinoids
So
for the win, Sherry.
cannabinoids for the win.
Yeah.
Yeah.
All
Ooh,
right. What do we got going on?
what we got going on is Mark and I just started our mastermind group at the Green Nurse every
Monday.
other Monday. So we're doing it Monday evenings from 7 to 8. I was supposed to put up an event yesterday, but I haven't put it up yet. But there'll be more details going up later today.
Hmm.
And so we're bringing in coaches, health professionals,
Yeah.
nurses, people that
Yeah.
are interested in learning how to incorporate cannabinoid education into what they're currently doing, and
Hmm.
for those that really want to enter into the space and do consulting and coaching. So Mark and
Right.
we're working with people, we're teaching them all the ins and the outs and the tips and the tricks, and we're doing case studies covering the endocannabinoid system and answering
Hmm.
questions, to help more people get out there educating on this most misunderstood plant in the world.
Yes.
And then
And we're
tonight,
looking, yeah. And we're looking
looking
for some nurse practitioners who want to learn how to do certification in Massachusetts and actually other states too.
states. Yeah,
If you got folks in Iowa, we're looking to expand into all states that have a
states.
medical card program. Of course, we do consultations worldwide. So anybody wants to utilize cannabis medicine, we will consult and coach. But if somebody specifically wants a medical card, we'll also help with that too.
Yeah,
And in
you have to get it in your
Massachusetts,
own
we're
state.
looking for some nurse practitioners who want to
Join.
learn the process, and it's really super simple. And we'll hold your hand through the whole thing,
Yep.
and together we'll get some folks who want a medical card to actually get the medical card. And in Massachusetts, you know what? The medical program's not that bad. It's pretty
No, it's
darn
getting
good. As
better. It's getting
compared to
better.
other states,
Wow.
it's like it's good. It's good.
It's
Some other
good.
states, awful.
Yeah.
Yeah,
So I'm really
absolutely.
happy with it. It is evolving, it's growing. The Cannabis
Mhm.
Control Commission's great. We're going to actually talk
Yeah.
about that on Throwback Thursday. So we're going to talk about the history of cannabis in Massachusetts, which I thought would be kind of fun.
Yee! And
So
it's
yes,
got a long history.
it's got a long
And
history.
Sherry, tonight, 8 p.m., Nurse Mark and the Green Nurse Podcast. We've got a great guest. Who's our guest tonight?
I don't know if I can say her name right. Barbara Orchester?
Chester. Yep. She
Chester.
is, yeah, Barb is a fantastic,
Fantastic.
amazing cannabis practitioner who's been in the space actively for a while. She is super, super interesting, cool person.
And she's been a nurse longer than me. She's been a nurse, I think, for like 45 years.
Yeah. And you
Really
know what?
cool.
And here's the thing. She's been a nurse for 45 years, but she's in school right now. She's going for a PhD.
There you
Why
go.
not?
Exactly. So
Absolutely. She's
come,
got a great story. Yeah.
she does. So come join us tonight to learn about
Mhm.
these amazing health professionals, trailblazers, people
Mhm.
that have eliminated the box and are truly here to bring cannabis medicine and education to everyone worldwide. So join us
Inspirational
tonight.
story.
Yes,
Yeah.
inspirational
All right.
story.
We're ripping it up. That's it. I'm having an
Friday.
AFA day.
I'm
Yeah. Go
having
ahead.
an AFA day too. One last thing that we're doing on Friday, and that's
Yep.
up in the Green Nurse events. Frequency Fridays,
Of
energy healing.
course.
We talk about high vibes all the time.
Mhm.
Come and join. Come learn about the Healy, really cool machine, bioenergetic machine that is completely
Energy
FDA
healing's the
approved
wave of the
for
future.
microcurrent. It is. I look
No
at it:
pun intended. Yeah.
cannabinoids,
Mhm.
energy healing,
Yep.
psychedelics.
Boom. Oh, yeah.
It's the way to
Oh,
go.
yeah.
Wave of
The
the
great
future.
triad.
A great triad.
All right.
Yep. This
AFA
has been
Day,
great.
everybody.
AFA
Wednesday, May 5th.
inspired.
It is the only one you're gonna get. You
Yeah,
ain't getting another Wednesday, May 5th, 2021. Happy
yeah.
Nurses Week,
Oh,
Sherry.
yes.
Yes,
I forgot about that.
absolutely.
How could I forget?
Remember, it is your day. You get to call it. You get to and oh my God, go back to that original thing we talked about. And that is if you're in a situation today where you can see somebody else is angry, just try that experiment. Just turn your attention to the divine and see what happens. You'll emanate that energy and that it will change what's going on. So AFA Day, love you guys. Thanks for stopping by. Sherry, what's it all about?
Y'all know what it's all about. It's about living your best life and helping others do the same. Thank you, everyone. Stay elevated. We love you.
See you tonight.